everyone. Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinosa, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled Let's Talk About Anxiety and Cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speakers, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we will get to as many as possible. And to introduce today's speakers, Iryna Singh is an oncology nurse practitioner. She has extensive clinical experience of inpatient and ambulatory care of cancer patients. She is certified as an advanced oncology certified nurse practitioner. She works collaboratively and independently providing care for patients undergoing cancer treatments, including but not limited to chemotherapy, immunotherapy, and supportive therapy. She has experience caring for patients on clinical trials. Her special interests include immunotherapy, managing adverse events, patient education about cancer, and treatment. Svetlana Akoyeva is a clinical dietitian with the Patient and Family Support Program of Cedars-Sinai Cancer at the Angeles Clinic and Research Institute. Svetlana has been working in oncology since graduating with her master's degree from CSUN Northridge in 2012 and has earned advanced certifications in oncology, nutrition, and diabetes care. She works collaboratively with the medical team providing nutrition intervention for patients during treatment and nutrition education on risk reduction, lifestyle intervention, post-treatment healing, and recovery. Jennifer Drew is a clinical social worker with the Patient and Family Support Program of Cedars-Sinai Cancer at the Angeles Clinic and Research Institute. Jennifer has been working in oncology since graduating with her master's degree from USC in 2015 and has earned advanced certifications in oncology and hospice palliative care with a passion for incorporating therapeutic mindfulness and trauma counseling skills in her work. She is a qualified mindfulness instructor through the University of Massachusetts and recently became certified as a somatic experiencing practitioner. It gives me great pleasure to welcome today's speakers, Iryna, Svetlana, and Jennifer.
Thank you so much, Abby, for that warm welcome. And we're going to go ahead and get started. I'll be sharing my screen and I'll be right with you to do that. Okay, can you see that?
Yeah, I think this is seen enough.
Yes, we can see it.
Perfect. Okay, great. Thank you so much. So today we're going to talk about anxiety and oncology from a multidisciplinary perspective. And Svetlana, Iryna, and myself, we are very happy and honored to be here with Cancer Support Community LA. So thank you all for joining. Our objectives are to provide education about the relationship between cancer and anxiety, to be able to understand and identify the contributing factors to anxiety as either a patient or caregiver or a professional in the community, and to learn how to access anxiety management solutions in your environment. So when we think about health, one of the things we want to consider is, what is health? How do we define health? So what we really like to do is go back to the World Health Organization's definition that health is a state of complete physical, mental, and social well-being. It's not merely the absence of disease or infirmity. This definition has been in existence since the mid 1900s, and our healthcare system has continued to function from this simplistic perspective. Healthcare is actually about treating disease and not promoting holistic health from this definition. However, what we're doing here is we're taking a multidisciplinary approach, and we're talking about physical health. We're talking about mental health, social health, nutritional health. So we're taking a 360 perspective on what health is. So what we want to talk about from a mental health perspective is really, we want to talk about the relationship between cancer and anxiety, to know the contributing factors, and really to think through how we address what mental health is. So when we talk about anxiety, we like to define that.
Yeah, let's start with the definition of anxiety. What anxiety in general, not only cancer-related anxiety. One of the definitions is a state of feeling uneasy and apprehensive in response to vague, non-specific, or unidentifiable threat. So we all have situations when we feel anxious, when we prepare for the test at college, we are waiting for job interview. It's natural to feel anxious, and it stimulates. Sometimes it stimulates. It's a good thing to feel anxious in those situations. But patients with cancer, they also experience anxiety related to their diagnosis, treatment, and post-treatment future. It's very important to identify anxiety early. And patients with cancer, they have different levels of anxiety. And some patients will experience severe level of anxiety. And there are different factors, they play a role in anxiety in patients with cancer. If left untreated, anxiety can cause serious side effects, GI distress, sleepless nights, stress at home. So it's very important to identify anxiety and help those patients early during their treatment.
And to add to Iryna, what you're sharing, what we have on the screen as well, is that there's certain risk factors for people who have anxiety and also a cancer diagnosis. So what we take part in as a multidisciplinary team is a comprehensive screening mechanism. And one of the things from a social work and a healthcare perspective is that we really want to destigmatize talking about mental health. And, you know, it's really important to look at this graph and notice that of the adult population in the US, 25% have what would be qualified as mental health disorders. And 58% of the population would have a medical condition. So if we look at the overlap in this Venn diagram, we see that 68% of adults with mental health disorders have medical conditions, and 29% of adults with medical conditions have mental health disorders. Now, that's just the defined mental health disorders. We also expect our clients to go through potential grief processes, grieving a life that didn't include a cancer diagnosis. And those grief processes are not categorized as mental disorders. So the number can, and the percentage can be much higher than what you're seeing on the screen. So there's many, many types of anxiety. What Iryna mentioned was eustress, or when you're doing a presentation, the type of stress that's really helpful to get you to take action, to move forward in life, and that can be really beneficial. However, there's many types of anxiety that could prevent healthy coping with a cancer diagnosis. Some people do have the mental health disorders we talked about that are diagnosable and quantifiable, like a generalized anxiety disorder. They might have panic attacks, obsessive compulsive disorder. And then Many people have other types of anxiety or phobias or fears that could include health anxiety, medication anxiety. We see people with needle stick anxiety, or they don't want to see blood draws. And of course, the greater anxieties such as post-traumatic stress disorder. So there are many different types of anxiety. And again, just to normalize that anxiety is something that your team can help you with if you let them know. And then your team is also assessing along the way for these different types of anxiety. One of the most common types of anxiety with cancer, of course, existential anxiety and health anxiety. So we'll start with the health anxiety on the right. So somebody might misinterpret a bodily sensation, and that might cause worrying thoughts. They might go to Dr. Google, who we love to recommend you don't seek a second opinion from on Google. And that could contribute to physical, emotional, mental signs of anxieties or symptoms of anxiety. And then existential anxiety. So many people don't even want to say the word cancer, or if you're talking to friends or family, somebody outside of the cancer clinic or somebody who hasn't had a diagnosis themselves, that can trigger a lot of existential dread. People can be thinking about meaning and purpose, their legacy. So the anxiety around death and the grieving process around a cancer diagnosis can certainly come up, and it's expected. There is absolutely a normally expected response to receiving a diagnosis that would bring you to a cancer clinic.
As we learned that anxiety might be a natural part of our daily living, some of the symptoms, psychological symptoms of anxiety, sometimes really impact our quality of life, like fatigue, excessive anxiety and worry, restlessness, irritability, difficulty sleeping, increased muscle ache and soreness, and impaired concentration might be really bothering us and impact quality of life. And some of the system definitely might be managed by comprehensive approach. It's another part of physical symptoms of anxiety: flushing, feeling of the mind going blank, muscle tension, sweating, heartbeat irregular, upset stomach, trembling, lightheadedness, shortness of breath, dizziness, and nausea.
So Svetlana gave us good description of symptoms, physiological, psychological symptoms of anxiety. As a medical provider, what do we look for when patients present with those symptoms? When somebody comes and tells us, oh, I have difficulty sleeping, my heart is racing, I'm very irritable, it doesn't mean that we tell them right away, oh, you have anxiety and here's prescription for you. We want to make sure that patients don't have something else that can cause these symptoms. We get their symptoms, information about symptoms, which is called subjective information, subjective symptoms. And we look for some objective information. Look at their history, previous medical history. Do they have any medical condition that can cause similar signs and symptoms? Do they have irritable bowel syndrome? Do they have thyroid disease? Maybe they have some cardiac issues, atrial fibrillation, irregular heart rate. And we perform physical exam, listen to their heart, lungs. We can order some labs, check their thyroid function. With some treatment, especially immunotherapy, thyroid function can change, and that can trigger some of the symptoms similar to anxiety. We can perform EKG and see if they have any changes in their heart activity. Sometimes CT scan can be helpful. Patients with cancer have pleural effusion. They have fluid in their lungs, and that can also trigger similar symptoms to anxiety symptoms. X-ray, we can order X-ray and see maybe they have some pneumonia, and some of those symptoms can be explained by pneumonia. We review a list of their current medications, check if they have any new prescriptions, any changes of current medication, dose, frequency, and also we look at the risk factors and evaluate their nutritional intake, and that's where help of dietitian is very helpful. And we look at their psychosocial picture, who they live with, do they work, what is their age, their previous experience, life experience, and we coordinate with the social worker if they need any help and additional assessment.
So from a social work perspective, what we're looking at is a biopsychosocial spiritual assessment. We're also looking at social determinants of health. So from the perspective of the biological, Iryna just presented what we're looking at biologically. We're also looking at psychological issues. Are there changes in cognitions, emotions, behaviors? Are there a history of any kind of mental health support that somebody sought over their life? Are they taking medications? Are they seeing an outside therapist or psychiatrist, for example? And then we have a chaplain that's also part of our team. And as a social worker, I also assess somebody's spiritual orientation, because beliefs, spiritual orientation can be very supportive. And some people are part of a religious organization, but some people find spiritual support through nature and have their own relationship with a personal spirituality that can support them through a diagnosis. And then we also look at the relationship to social environment, again, as Iryna said. And part of this biopsychosocial spiritual assessment is really looking at somebody's relationship to existential issues that can also come into play, because that does get brought up when somebody's diagnosed with cancer. In the social determinants of health, or we're taking a deeper dive into the social aspects of somebody's health, looking at their economics, environment, their availability to food. Are they in a food desert? Do they have adequate food? Looking at their education, really thinking about somebody who's walking in the door. They may have a completely different relationship with medical terms and might not have what we call health literacy. So education becomes a really important conversation, because as professionals, we work in this environment every day. And we need to remember, and our team needs to remember, that somebody walking through our doors has never likely gone through the cancer before. So all the terms we use on a daily basis are oftentimes new to our clients walking through our doors for the first time.
As we mentioned before, there are certain risk factors that patients have, and they have high risk for anxiety. Some of these factors are related to their disease, to cancer diagnosis. Some of the factors related to treatment that they are undergoing, and assessment of their lifestyle and nutrition also help us identify some nutritional triggers of anxiety. Somebody who has high intake of caffeine or sugar-rich foods can have symptoms very similar to anxiety or can trigger anxiety attacks. And also interpersonal social situation can trigger some anxiety in patients. So when we look at the disease-related factors, it can be new diagnosis. When patients face diagnosis of cancer, they immediately, they think about death, and it's life-threatening diagnosis for the patient sometimes, most of the time. And then they start treatment. They don't know anything about chemotherapy, immunotherapy, what to expect. They are very familiar with the Hollywood movies when patients sitting in the infusion room, they are throwing up, and they have this fear that they will be in the similar situation, and that can cause anxiety. There is also social stigma of diagnosis. Diagnosis of cancer is still not very well accepted in some ethnical groups, and some patients will try to hide it from family and friends. Sometimes anxiety triggered at the end of treatment, patient finished treatment, and they don't know what to expect. Are they cancer-free? Is it gonna come back? How long they're gonna live? So there are a lot of questions they face at the end of treatment. Advanced stage of disease. Some patients present with the cancer that spread to the lung and brain at the time of diagnosis. Suddenly they have advanced stage and their life completely changes. That can definitely cause a lot of anxiety. At some point, we are not able to help, and treatment and all the interventions come to the end, and we talk about end of life interventions, transition to hospice, and this definitely causes a lot of anxiety in patients. Some physical symptoms can cause anxiety: poorly controlled pain, difficulty sleeping. Somebody who has lung cancer or cancer metastatic to the lung, and they have difficulty breathing, they have fluid in the lung, they have dyspnea, it definitely can trigger anxiety.
What is dyspnea?
Difficulty breathing.
Difficult, thank you.
Sorry.
That's what I was actually, that's a great example. Sometimes we use words
Yeah.
that I'm like, can you translate that?
And pruritus, in simple terms, it's when patient has itchy skin. It's very
Thank you.
irritating,
Yes.
so it can definitely impact quality of life, cause some irritation and anxiety. And some treatment-related factors that can trigger anxiety: long treatment. Some patients have different types of treatment. Let's say women with the breast cancer, they undergo surgery, then they have radiation and chemotherapy. It takes long time from beginning till completion. So this long treatment and unknown what to expect from chemotherapy, from radiation, that can be definitely a trigger for anxiety. Some patients will require blood transfusion or bone marrow transplant. Again, you don't know what to expect, how you will react. Are you going to have some reaction? That's definitely trigger for anxiety. Surgery and recovery after the surgery. Some patients have complications, and long recovery definitely impacts quality of life. Some changes in body image, hair loss, mastectomy, changes in skin during radiation. Patients with GI cancer can end up with ostomy. It's a bag that stool comes to that bag. So that definitely changes your quality of life, changes your image, and definitely can trigger anxiety. At some point, some patient will progress, their disease will become more advanced, or after a period of cancer-free, it will come back, and this is another risk factor for anxiety. And most of the patients that what we witness over here, when they come for scans or tests, they have such term as scanxiety, scan-related anxiety. And it triggers their blood pressure. When we see them in clinic, everybody's blood pressure is sky high due to anxiety.
As a part of our assessment, we need to make sure that no nutrient deficiency might be a trigger or impact quality of life. We do screening for malnutrition, and we assess nutrition impact symptoms. we always consider medical condition of our patient like diabetes mellitus, irritable bowel syndrome, CB or a small bowel obstruction, and healing and recovering after Whipple procedure. Nutrition impact symptoms sometimes when we have our mood fluctuations, sometimes we have sugar craving, and sugar craving definitely might cause our blood glucose goes up and down, spike and crashes, which is a big part of our mood fluctuation. Upset stomach, bowel movement changes, it might be constipation, it might be diarrhea, everything is under our assessment. What helps manage an anxiety? And here is, and of course we know one size does not fit all. So we have personal approach for every our patient with consideration all factor, where is our patient live, with whom, what they eat, what's the food, accessibility, management of symptoms, pain, insomnia, eliminate environmental trigger, manage nutrition, psychotherapeutic modalities, pharmacotherapy. Psychotherapy can be as effective as medication. Physical activity helps to reduce symptoms of anxiety and cancer-related fatigue. And for best outcomes, this is what we learn to working together. It's combination medicine and lifestyle therapy and behavior modification therapy.
So as a medical providers, when we see patient with anxiety, when we ruled out all the causes, other causes, and we think this is anxiety, we talk about starting pharmacological therapy for patients. And we ask if they're willing to start. Not every patient will be willing to start taking medication. Some of the patients, they prefer therapy, psychotherapy first before they start medication. Every patient is different and we respect their choices. And for patients who agree to start pharmacological management of anxiety, we discuss different options. One of the main options to use antidepressants. It sounds really strange. Why would we give antidepressants to patients with anxiety? But this is the main line of treatment. And the way they work, they stimulate some receptors in the brain that produce some chemicals similar to the situation in depression. And most of the patients with anxiety, they also have underlying depression. So use of antidepressants is very beneficial for patients with cancer-related anxiety. There are different other types, anti-anxiety medications, anticonvulsants, beta blockers. They can be also used as a pharmacological management. And of course, medications have some side effects. They can cause some sexual problems, weight gain. And that's where we ask for nutritional consult, and we ask Svetlana to come and talk about food, what they can eat to help them with the weight management during this therapy. They can have some changes in their mood. They can feel that they're dependent on medication. It's very important to understand that every patient is different and how long they have to take medication is different from patient to patient. If you have any concerns, if you need to take medication, please talk to your doctor. They will be able to advise you better what's the best for you.
So from a mental health perspective, again, mental and physical health, they go in tandem. And in fact, there have been better outcomes of combining mental health support, so psychotherapy, with medication is the optimal outcome, as Svetlana mentioned before. However, both medication and mental health support can be effective. So what can help you with the side effects of anxiety treatment from a mental health perspective is the awareness and education that you may actually feel worse before you get better. And that can be true for psychotherapy as well when you start to delve into some of the issues that maybe are not on the surface. You start to go deeper. Sometimes things get a little bit worse before it gets better, and it's important to have that education. And then practicing mindfulness, becoming aware of your thoughts and your emotions and also your body sensations. We call that in the mindfulness community the triangle of awareness. So becoming aware of thoughts, emotions, and body sensations. And if you're in crisis, being aware that there is a crisis line, 988. And if there's any kind of suicidal ideation, 911 is who you would call. 988 is crisis line for mental health, and they're available 24/7, 365 days a year.
Get regular exercise. It's very helpful during cancer diagnosis, and it also helps with anxiety. And when patients start taking antidepressants, they don't feel, they don't get any changes. They don't feel that anxiety is gone right away. It takes about couple of weeks. And during those couple of weeks, they may have some thoughts, depressive thoughts. They may have thoughts, ideas about killing themselves. So it's very important for the family to be aware what's going on, that patient is taking some new medication. And if there is something happens that you notice, please call 911 immediately.
Enjoy your fruit and vegetables. Enjoy variety of fruits and vegetables. Go for low fat, low sugar diet. And dry mouth, one of the very common symptoms with an anxiety. You might just be dehydrated. Drink enough water. Use sugarless candy and brush your teeth regular to increase salivation. Is another part of nutritional management of an anxiety. Lifestyle intervention, as we all mentioned already to you, based of course on your medical condition. Talk to your health provider. Nutrient-dense food patterns, it's lifestyle. You're not on a diet. We promote your lifestyle and your nutrient-dense food patterns. Omega-3 fatty acids, magnesium, probiotics, vitamin group B, antioxidant, hydration, and of course, limit caffeine, alcohol, and added sugar.
And knowing when to get professional help is incredibly important. If you notice that your anxiety or the person for whom you're caring, if their anxiety is worsening and beginning to interfere with their activities of daily living or ADLs, or their ability to perform basic tasks like laundry, preparing food, getting out of bed, or if you're no longer able to enjoy life, we want to make sure that you communicate this to your doctor. If you're increasingly distracted or irritable. And I think this is really important to know. Irritability can be a sign of depression as well. And also, irritability can be correlated with pain and nausea. So, understanding there's a multi-directional relationship between irritability and anxiety and other mental or physical health symptoms is really important. If you're feeling fatigued and tired a lot, talk to your medical professionals, reach out for support. Most cancer centers have support like Svetlana, myself, Iryna, and you can say, hey, I'd like to talk to the dietitian. I'd like to talk to the social worker. You know, how can you really support me? Is there rehab medicine, which we have available here? And if you have difficulty making decisions, or if you're worried about potential outcomes of treatment and diagnosis, it's a great time to talk to somebody, maybe one of our chaplains. And if you're increasingly feeling that you have no meaning and purpose in life, We really want to get you supported. Many institutions, ours included, have groups that support meaning and purpose, especially for people with metastatic disease. There are support groups available. And of course, those of you members of CSCLA are aware of the many wonderful support and individual and group support offerings. So when we talked about identifying environmental triggers of anxiety, that can be the internal environment, like body sensations, fatigue, feeling tired. It can be external things like changes in your appearance. It can be changes, as we mentioned, in functioning and increasingly feeling stressed by things that didn't used to stress you previously. Maybe previously doing the laundry, preparing food was not stressful, but now it is. If somebody near you, and I mentioned support groups, if you're in a support group with somebody who passes, that can be very, very triggering. I know that has happened to some of our clients here, that they've had to cope with their death of somebody close to them in a support group with a similar diagnosis that can really trigger our own existential and health anxiety. So if you have intrusive mental thoughts or memories, really wanting to think about your proximity to physical or mental illness within your family environment and your living sensation. And thinking about what's triggering. Is your sense of smell different? Does food smell or taste different? And talking about these things, these can all be different aspects of health anxiety. And a lot of times changes in appearance, not only weight gain or weight loss, but also swelling or changes in hair, can be triggering for men and women. And I had a client say to me, "Oh, well, you didn't look a certain way, so I thought you were okay." So really staying curious about your own experience and communicating your experience to your team, and stopping them and say, "Hey, I'm having this experience. I'm concerned. Can I talk to somebody?" So advocating for yourself and being aware that these triggers are something to watch out for. And one of the things that management of anxiety can help, previously you might have had a trigger like waking up with a pain in your back and thinking, "Oh my gosh, is the cancer spreading? Is something going on?" You might have had feelings of anxiety or frustration, worry, uncertainty, doubt, existential concerns. Your body can then react to those thoughts. And this is a multi-directional relationship between feelings, body, behaviors, and thoughts. So your body might react to your thoughts or your feelings or your behaviors. You might have racing heart, increased nausea, more pain, problems with breathing, as Iryna mentioned. And then you might go online, again, back to Dr. Google, not being the best second opinion. And you might isolate, you might not go out. And your thoughts might be, "Oh gosh, are things worse? I'm going to be in this state forever. This pain is never going to go away." So this is what an anxiety cycle might look like pre getting some help or support from your team. But after you are getting some treatment for anxiety from either medication or talk therapy or both, when you wake up with a pain in your back, you might have thoughts that are more reasonable, more balanced, centered, and calm. Your body might feel more rested. Your breathing might not change, and you might have less nausea because you have more reasonable thoughts at this time. You learn to replace negative thoughts with positive thoughts, for example, using cognitive behavioral therapy. And then you share your experience with your loved ones. You continue to engage in healthy behaviors like exercising, taking gentle walks as approved by your medical team, finding something fun and something that gives your life meaning and purpose, no matter what your physical condition is or your health status is. And then having thoughts like, "Oh, well, my doctor just said I need to rest, or they said to come in. Let me reach out and discuss what it is I might need or what might be a reasonable explanation." So this really illustrates what anxiety might be like pre-treatment and what it might be like post-treatment.
So now let's talk about what do we tell patients with anxiety and what resources we have. So first of all, if you identify that you have anxiety, talk to your doctor. It's very common, it's very natural response to cancer diagnosis. A lot of patients with cancer, they have anxiety and depression, and sometimes it's very challenging to recognize, and it goes under recognized for many years for some patients. And that's why we have this presentation today, because we want to spread awareness that cancer-related anxiety is real and it's very serious diagnosis. And you can get help from your healthcare provider, you can get therapy, you can get nutritional changes. And I think the next step we want to talk is nutritional education. What can help you to deal with the anxiety and nutrition?
And the best education, it's always practice.
Yeah.
And I would ask to help, because as we already learned, sometimes when we're anxious, sometimes we drink too much coffee, sometimes we eat too much sugar, sometimes we just drink alcohol. Let's be educated about this. So I give Iryna and Jennifer for these things. So first of all, we not represent any product that you see here. We not demonize any product. We just inform it how to manage it. So I want to give you some idea how you can manage added sugar. Jennifer, how many added sugar you have in your drink?
So it looks like the total sugar for this drink is 32 grams of sugar,
Okay.
and the added sugar is 22
22.
grams.
Because basically we want to focus on added sugar. Iryna, what about yours?
46.
46, it's total?
Total.
It's a total and it's added sugar.
Yeah, that's only one.
So how you can manage, is it less, is it more, what I can do about it? Let's pretend average person who eat 2,000 calories a day. We do recommend that your added sugar should not be more than 10% out of your 2,000. It's gonna be around 50 gram added sugar. So Jennifer, what do you think?
So if I were to drink this drink, this is a quarter. No, this is more. This is almost
Almost
this is half.
half.
No, this is
It's
more than
almost
half of
half.
sugar for a day.
But it's just one drink, right?
So what you're saying, reading food labels,
Read
is
food label,
very important.
manage it. Let's see if you know it's like your half of your daily added. How about you, Iryna?
So it means almost daily.
It's almost daily dosage. 43 added sugar, it's almost daily dosage. It's all about food label reading.
Well, and that's only 12 ounce.
And that's
Forget
12
about
ounce.
going to
One
like
drink, if you have
the
cup of,
big milk.
yeah.
Right. So now I want to give you a little bit education about coffee. So when we start drinking and enjoying coffee, our cup looks like this.
How
Many
ounces?
years, it's like 4 ounces.
Okay.
Then we want a little bit more, and sometimes we just finish this. So manage it up to 4 cups. It's gonna give you 400 milligram caffeine a day. It's acceptable, but no more.
So,
And-
you're
Mhm.
really saying to manage the caffeine intake.
Caffeine and added sugar in your diet. And now I want to give you a little bit education about alcohol drinking. Sometimes when we mention a glass of wine, it might be a little bit different glass of wine. 1 serving of alcohol, it's a 5 ounces. So this, it's kind of 12. Means if I open this and just give half, little bit less, this is gonna give me 5 ounces of alcohol. Not this. See, it's a different glass of wine.
So it means these are 2.
It's a 2 servings in a 1 glass. This is how you can manage. You still can be social. You can still enjoy, because sometimes it's part of our social event, but manage it.
So reading the food labels, limiting sugar,
limiting
limiting caffeine.
and definitely
Think
managing
about
alcohol,
sugars and your
Yeah.
alcohol.
alcohol consumption.
So one of the things we wanted to talk about anxiety, one of the things that can really help reduce anxiety is to develop internal safety, environmental safety, feel safety and trust with the medical team. And so we really want to emphasize that building safety within yourself, outside of yourself, and in your environment. Safety is really what happens in therapy around anxiety. And I think what we want to really highlight is that we want to validate and normalize that this is a completely normal experience to have anxiety related to any cancer diagnosis, and let you know that there is uncertainty along the trajectory of the cancer process and the relationship with the cancer diagnosis. And to notice that if anxiety is acute, if you're in a moment where you're sitting waiting for your scan or you're on the table with the scan, regulating your breathing can be a really wonderful intervention in the moment. And I've actually done that with clients who
Yeah,
have high blood
witnessed
pressure,
this.
for example, and then we'll do some breathing activities and they retake their blood pressure a few minutes later and it has reduced.
So I want to summarize our today's presentation. Anxiety, cancer-related anxiety is real. It's very important to identify it early. If you think you have anxiety, please talk to your healthcare provider to get help. And sometimes patients with anxiety, they feel like they want to finish their life. They have some suicidal thoughts. They want to harm themselves. So there is help. Please call 988. This is suicide helpline. And if family notices something unusual, something strange, please call 911. Yeah, we are here to help you. Yes, and hopefully this information today will help our patients and other patients in the community.
And thank you for attending this Friday afternoon, our seminar. We hope you learn something. We enjoy to talk to you, and just remember, we're here for you.
And we'll invite Abby to come back on and to help facilitate question and answer.
Yeah.
Yeah, thank you, Iryna, Svetlana, and Jennifer. We really enjoyed your presentation. We do have a few questions in the chat, but if anybody else wants to put any other questions, please feel free to do so. With that, I will go ahead and get started. So someone is asking, do you have any practical tips for family caregivers supporting the cancer patient with managing their anxiety?
Yes, absolutely. There is a community at CSCLA, right? There's a caregiver support group.
Yes.
So there is a caregiver support group, and I was fortunate enough to participate in the creation of some of the caregiver materials in the community. So seeking support is really important. What we want to do is, again, if you remember the slide where we talked about social isolation or isolating in response to anxiety, that's going to be important. I also really include in that conversation seeking out training in management strategies of anxiety, such as attending a mindfulness group. There's a wonderful 8-week group called Mindfulness-Based Stress Reduction. There are classes. Is that open to caregivers as well, Abby, or is that just to patients, MBSR?
Yeah, so our MBSR is open to anyone impacted by cancer.
Okay, so taking advantage of the resource, since you're already familiar with cancer support communities, attending the MBSR group, doing things that help regulate your nervous system, such as being in nature. In Japan, they call it forest bathing. You can go for a walk and, through some trees. You can here, we're blessed to have the beach. You can go for a hike. So spending time in nature or doing whatever hobby you enjoy. Some people really enjoy coloring for anxiety because what that does is allows you to focus on something different, because if you're doing a complicated coloring book or painting or activity, then you're focused on what's right in front of you instead of the thoughts in your mind. So anxiety is a relationship, again, between thoughts, emotions, body sensations. So starting to notice that, slow things down, and breathing. If you have a chance to take a breath work class, that's really can be so helpful to just stop. There's one intervention called 1 foot, 2 foot, and breathe. So you become aware, you can do that in, 10, 20 seconds. You become aware of sensations in your right foot, sensations in your left foot, and you just take a long breath into your stomach. And that takes a few seconds, and you can do that.
And cook together with family once a week. Just do some, new recipe. It's always, just put your anxiety down. And it's enjoyable, and you just get your balanced nutrition, dense food.
Yeah, there is always a way to modify some mindful interventions like forest bathing. If you have difficulty walking, if you cannot go for a walk, you can create forest in your house. Just plant some flowers in your house, plant some plants. Yeah, bring forest to your house, surround yourself with nature.
Yeah.
Or use some aromatherapy. Yeah.
And if you start to feel yourself getting irritable or short-tempered, just say, you know what, I'm gonna go walk around the block.
Mm-hmm.
Or I'm just gonna go step outside. I'll be back in a couple minutes. I just need to take a pause. So pausing when you start to
Pausing.
feel the anxiety, the
good.
nervous system,
Very good.
or that instinct for fight or flight.
Perfect. Thank you so much. And then someone is just asking if you can please repeat what the daily sugar dose is.
So daily sugar, added sugar, we're talking about added sugar, no more than 10% of your calorie intake. Let's see if your diet is like 1,500, right? I just mentioned 200, but it's like average person who doesn't exist. Let's see you have your 1,500 calorie a day. Take your 10%. This is your dosage, added sugar.
It means 150 calories.
150, yes. 1,500.
Yeah, on 1,500 calories. 10% is 150.
150, you just need to divide for 4, and if you can make calculation, we will have our
About
gram.
40 grams.
40 grams.
A little bit
Thank
less
you.
than 40.
Yeah.
So you're saying if somebody, whatever their calorie amount every day,
Yes.
10% of your daily calories is for sugar. And sugar, so calories you divide by 4, and that's how many
Divided
grams.
for 4, this
grams
is
of
how you
sugar.
will have your gram that you can manage it on your food label, because they give us sugar in gram. Very good question. Thank you.
Thank you. And then one other question. So someone asked if it was okay 4 ounces for 4 4-ounce cups of coffee, if that's an okay intake.
One more time, 4 cups.
4 cups of 4 ounces of coffee, cups of
Yes,
coffee.
4 cups, because 1 cup, it's like 8 ounces, or it's a 1 cup, it's around 100 milligram of coffee. So up to 4 cups for 8 ounces, it's okay. Means 4 cups for 4 ounces. You're more than welcome. Enjoy.
What's the limit on caffeine in a day?
400 milligram a day.
400 milligrams of caffeine.
Yeah, caffeine a day.
So 100 milligrams of caffeine for
It's like
8 ounces?
Yeah, it's like 1 cup, kind of around. Of course, it's a different, but average. Again, make it average. Make it like, you don't need to, count everything. Kind of give like pluses, minuses.
Yeah.
Yes, get this knowledge.
Thank you. And then someone is saying they would love to hear more about daily and weekly things one can do. It's hard to avoid triggers when you are dealing with cancer.
Yeah, absolutely. From a psychotherapeutic social work and mindfulness perspective, what one can do on a daily basis is set a timer and for some time a day for 5 minutes of spending time with yourself, and just 5 minutes. And you can work more or less depending on what your day is, but 5 minutes to do something just for you. That could be anything that dispels anxiety in the body. That could be something like you might need to scream into a pillow. It's because it's so hard, right? It could be coloring, all the things we talked about, coloring, walking, meditation. It could be any of those things, but something where you set those 5 untouchable minutes for you every day. It could be journaling. It could be watching a funny YouTube video. It could be anything. Laughter, crying, all of these wonderful things are releasing the stress hormones from the body. So some way to release that, moving the body is ideal.
And drink enough water. Sometimes when we're about to get some sugar, do a couple sips of water. Sometime you will change your mind.
And you can always plan ahead. If you know that you have anxiety related to scans, you can plan ahead your breathing. Yeah, so you prepare yourself. You can pre-pave your scan experience.
Yeah. And that's on a daily basis. And then on a weekly basis, set aside a larger chunk of time. That's time for you, where phones, unless you like the phone, but you might need quiet or, space from a phone. So really
Very
being
good.
mindful about media consumption, technology uses, and creating a space that supports your health overall and well-being. So mental, physical, emotional, spiritual. So we really want to make sure. So for some people, that's prayer. Some people love ritual. There's some religious traditions that light a candle when they're thinking about somebody. So lighting a candle, burning incense, there's ritual is so underrated. I know some people, they wash their hands every time they walk in and out of the building. So ritual is a really important aspect to help and create some rhythm in the midst of something that feels completely out of control.
Perfect. Thank you so much. And we just have one final question. Someone is asking what a team consists of. And for example, you all are a team. And they asked if you have to ask for a team because they only have oncology and internal medicine.
They only have oncology what?
And internal medicine.
Okay. So the team can look different from different places. If you're in a larger institution like Cedars or one of the other large institutions, you will have access to a team such as ours in the patient family support program that partners with the oncology treatment team. And then if you're in a location that doesn't have access to a team such as ours, that can be combined from resources such as cancer support communities where you can do individual or group support, also fun activities, attend classes. And really taking access to that, you can seek chaplaincy or spiritual support from your organization or by seeking yoga or mindfulness classes. The UCLA Mark Center has mindfulness classes inside LA, obviously CSCLA. So really looking for what supports you spiritually. Joining a hiking group, perhaps for some people, helps them with their anxiety, and then cobbling together the team. So it'll require a little bit more work, getting connected with those resources in the community, and they do exist. That's the whole point of CSCLA, is to help provide that community. And feeling isolated can contribute to anxiety, and being connected with a community can really reduce anxiety, where you feel heard and seen and supported.
Perfect. Thank you so much. That is all the time we have for today. And I want to thank Iryna, Svetlana, and Jennifer again one more time. We really enjoyed your presentation and you taking the time to answer our questions. And I also want to thank our attendees for joining us today. And just a few things, if you'd like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And if you have any questions, please feel free to email us at info@cancersupportla.org. And then we also just wanted to share about one of our classes. I think Kathy's going to bring that up again.
No.
If it's not working, it's fine, Kathy. But we do have a number of different classes. We do have a we have a mindfulness is medicine class that meets every Tuesday from 3:45 to 4:30. That meets virtually. And if you want any more information, please feel free to check out our website. Or you can also scan the QR code there if you would like to register. And you can take a look at more of our other classes on our website. And again, if you have any questions, please feel free to email us. And thank you once again, Iryna, Svetlana, and Jennifer. We truly enjoyed having you here today, and we hope to see you all at our next webinar. Thank you.
Thank you.
Thanks.
Thank you.